Of course, maps are absolutely critical for health geographers, and definitely one of the things is mapping where the location of certain diseases might be. And one of the earliest examples of this is a guy named Valentine Seaman, who essentially in New York City plotted and started mapping where yellow fever was starting to affect individuals. And so it was previously thought that yellow fever was something transmitted strictly from person to person, from those migrating across the Atlantic who are bringing with them the disease. He found that actually, because of the location of the yellow fever, as far as where people were come in contact with, it was actually some crappy areas in which there was a bunch of standing water, in which there was a bunch of mosquitoes and diseases breeding, and thus yellow fever was more contagious and then spread to humans. And then from there, he then identified other areas that then were affected via network diffusion based on who those people that had yellow fever encountered. And so here we see kind of this early example of how we can use mapping to better understand a particular problem in health geography. Another early example of what geographers do when we think about health is this example of cholera, in which this guy back in the 1830s essentially mapped the origin and diffusion of cholera, and so found the origin and then spreading throughout particular nodes in the United States, and how it then went upstream based on doing surveys, based on doing research on who all has this particular cholera disease, and then essentially mapping that. He then showed the flow, and so then people were more aware of this disease that was ravaging, was killing large numbers of people in this particular area. Probably the best and earliest example of geography being used to understand health was a guy named John Snow, who mapped a cholera outbreak in a London neighborhood back in 1854 in a book that was published in 1855. And so what he did was he essentially did surveys, he identified particular patterns, and he was starting to pick up on this notion that, we think about this particular cholera outbreak. Most people, the rumor was, word on the street was that this was something that was being spread via air pollution. Others said, this is because a bunch of bad people live in this area. So this is people who are sinners, who are, they have not followed their religion properly, so they're obviously going to then pay the punishment via death. Others said, this is just a bunch of poor people. This is a poor neighborhood, and so they just lack proper hygiene. He said, along with a lot of other doctors, this ain't true. These are false rumors. And so what he then did was identified, okay, I did some survey work. I've started to identify a particular pattern. There's a cluster of cholera outbreaks noted by these little black dots here in and around Broad Street. And so then what he did is he laid on top of that a particular map that showcased where all the wells were. And so these wells we can see on this John Snow map, they're labeled as pumps. And so where these wells and water pumps were located, and essentially what he did was he found an aha moment. Okay, there's this particular water pump in this particular area in along Broad Street that I bet is contaminating the people. So they go in, they clean up this water pump, they go in and do a little bit of investigative work, they find out that there's some sewage leaking into it. So essentially some poop and some pee is filtered into the water supply. People then drink it, people then bathe in it, and of course they're going to contract cholera. And so essentially they cleaned up this particular well, they cleaned up this pump, and then the cholera epidemic, the cholera outbreak in this particular area declined.
This here is research from Geography Department in collaboration with the IU Med Center. And this is looking at childhood obesity. And so Michelle Obama recently, that's the thing that she's going to, her issue that she's going to tackle. And this is something that we were already doing. And so childhood obesity, BMI is body mass index, and so think of that as body fat. The areas that are black dots are during a 5-year period. These are individuals who increased their body fat by a margin of 30.0%. And so they increased to a large degree. And so what we're trying to do is why? Are there anything environmental? Is there anything about their location, where they're located, and maybe the things that are nearby or not nearby, which might be causing high body mass index? And so first would be the location of fast food. When we look at the dining options in a lot of those areas where we see high concentrations of black dots, there's a high presence of fast food restaurants. And so that's essentially the only option in a lot of these different places. And so within Marion County, you also saw during that same time period an increase of 30 fast food restaurants within the county. And so when we look at these areas that have high change, in which they're having increases in body mass index, a lot of this is proximity to fast food restaurants, and especially when those are the only options. It's not like you have, Whole Food stores and Applebee's, and so you see overwhelmingly Long John Silver's and McDonald's in these areas, especially along transportation networks, key incoming roads that come into downtown and head out to the suburban areas. And so what we can also do is track the patterns of individuals. And so we attached a GPS to cell phones and kind of tracked individuals. And so what we can then do is create this massive database. And so all these individual points illustrate the location of an individual in different minute intervals. If we did every single second, it would just be too much data. And so here we can then quickly come up with a general pattern, and we can store all this data, massive amount of data on a computer. So this is once again the benefits of a GIS. So one of the things they also noted was location near a green space or location near a park. And so what we also noticed was that areas where you had high increases in body mass index had very minimal green spaces, very minimal parks, very minimal areas in which individuals can go out and get recreation, play football, run around, and so on. And so one of the ideas here is, well, let's increase green space in certain areas. And so during that same time frame, they did that. And so in other areas, they increased green space, created a park that was maybe left behind from a facility closing down. And what do you know? In those areas, body mass index decreased, childhood obesity decreased. And so understanding a little bit more about these patterns, these geographic patterns, can lead us to ways to mitigate, ways to come up with solutions to the problems.
Another example of what health geographers do here at IUPUI is related to heat events. So the idea here is we'll have cities that on average will have a much higher rate or much higher chance of people dying during an extreme heat event. And so during a summer period in which it's super, super hot, we can first off identify specifically, because of these various satellites in the sky and remote sensing, we can identify temperatures of different surfaces. And so what we can do is we can zoom in and identify hot surfaces. And this is real-time information. And so this is going to be situations where you might have cloud cover over one area. We'll obviously keep it cool, but if you have one area that doesn't have any cloud cover, it could then get super, super hot. So what we've done is we've started to look at and understand first off where hot places are during a summer heat event. But there's other things to consider when we think about people dying because it's too hot out. There's also socioeconomic variables as well. And so then we can think about where do we have also high numbers of old people. Old people, it takes them, it's harder for their bodies to keep themselves cool, and they're also less resistant to go out and buy air conditioning because back in 1950 they never used it. So you can see how there's maybe some cultural or age-related influences. Also could be income-related. When we think about keeping yourself cool, that costs money. And so when we think about what we can do is we can start overlapping different maps. We can look at the temperature map where it's super hot. We can then overlay on top of that where do we have a lot of old people. We can lay over on top of that where we have a lot of lower income individuals. And then from that we can go ahead and start to predict where people are more likely to die during a heat event in Indianapolis during the summertime. And then we can also then, of course, look over time. And so by putting these maps together over time, we can see where are we improving in areas. Where are areas that are, maybe, more risky in terms of heat-related deaths than others. And so this is Marion County, and so those red areas are mostly the dense urban areas in which you have a lot of asphalt, a lot of development, whereas the blue areas are more residential, but also more forested areas, especially on the left-hand side. You can clearly see that. Up in the upper left-hand side, that's where the big park is, Eagle Creek Park. And so we can see how cooler places, largely related to trees and less development, are then, of course, going to be less likely to have heat deaths. So then coming up with solutions. And so one example is by moving buses into particular neighborhoods where people might be more susceptible and using them as cool zones. And I realize that's not environmentally good to then just have a bus that's running its AC, but it's better than having people die. And so essentially providing mobile cool units. These are just examples of coming up with solutions to a problem from just the health geography perspective. I'm not saying we're the only answer. I'm just saying this is one more perspective to understanding our overall health and how to prevent death.